Hi, hello everyone out there. Welcome to the Kosh TV, and this is Janet. Um, as I always say, this channel is backed by a group of knowledgeable individuals, professionals who are very knowledgeable in their field of profession. Um, Thank you so much for tuning in. If you were a returning subscriber, thank you so much. And anyone who has stumbled upon this channel, please consider staying with us. Let's do this together, especially health professionals. Let's share ideas. Let's upgrade our knowledge, and let's impact the community. Again, my name is Janet, and this is Kosh TV on YouTube. Today, I am going to talk about something that is on the news, it's on the media, people are talking about it. First, actually, I'm going to talk about three things. One is the hantavirus that everyone is talking about. Hopefully, and with all resources put together, this isn't going to be another pandemic. Fingers crossed, I hope so. And the other two are some medical incidents that's happened in Ghana. Okay, I'm actually hesitating to mention the country. That's where I trained, and I'm so proud to say that I trained at one of the best universities in the world. Okay. Now let's talk about the hantavirus first. I'm sure most of you have heard about it. In the United Kingdom, I hear a few cases have been reported, or those who have been exposed to or have been in contact with those who have been exposed to the virus are being treated accordingly. It's a virus. I don't think we've heard much about this virus, but according to literature and what I have read and what I've heard from other doctors or health professionals, those who are mostly at risk or who are likely to carry the virus are those who have rodents. So if you live in a house where you have rodents living in the house with you, sometimes these circumstances are beyond our control anyway. You're likely to be exposed to such a virus. So we need to be careful. We need to clean our environment. Public health, it's a public health issue. So public health issue, you know what I'm talking about. So my colleague health professionals, please, let's take this opportunity to intensify our public health education. All right, let's take this opportunity to do that. And from what I know, when you are exposed to, or if you should come into contact with this virus within the first 4 to 8 weeks, you will be showing symptoms. You will show symptoms. The first 4 weeks, you will likely to be having chills, high temperature, muscle pain. Really muscle pain, and severe fatigue. And it comes with some gastrointestinal issues as well, like diarrhea, nausea, vomiting. So these are things you should be looking out for. Should you be in contact with somebody who has been outside the United Kingdom, or if you're worried, just check yourself to the nearest health care facility to be checked out. It progresses, and if it goes untreated, this can cause death. Okay, later your circulatory system will be affected. You will be having you will be showing signs of shock. Renal failure sets in, and when the major organs are affected in illnesses, we know what can happen. It can be very fatal. So when you feel unwell, you've come into contact with someone who has been out of the country, or people you don't know, or you've been to town, you've come back and you feel kind of unwell, you are exhibiting these symptoms that I've spoken about: fever, chills, gastrointestinal issues, severe back pain, leg pain, hip pain, something that hasn't been there, okay? Just check yourself to the nearest healthcare facility to be assessed and then treated accordingly. Okay, so now that we've got that out of the way, I am going to talk about two issues which I've pondered about. I've had a couple of discussions with some of the members of the Kente of Expert Club International, and it's sad, so disheartening. It's so sad. This shouldn't be happening in this day and age, with knowledge, advancement of knowledge, and I know we would say that it all boils down to resources, what you have available. Yeah, that is true. Resources do play a major role, but if these resources are not available, do we have other plans in case situations like this happen? The thing is this: yes, we are all knowledgeable. Those of us in the developing world, we know, we've studied. We've studied just like those in the developed countries. They have the resources which help them to give prompt treatment. Yes, we also require that. However, there are cases where you can actually work without some of these equipment or resources they do have. I'm going to do some comparison here, and then I'll proceed with what I'm going to talk about. In the United Kingdom, I live in England. I trained in Ghana, I lived in England. Of course, I've done some updates, I've done some trainings, I've done further studies. I have used these knowledge that I've acquired to actually deliver my nursing care, to do my assessment when it comes to dealing with my patients. Someone from the United States, if you look at things carefully, they are more rich in terms of the machines, okay? Those material machines, like machines, gadgets and stuff. I always have this thought that they are happy with using those gadgets, all right? They're very happy with using those gadgets. The plus for those of us from the United Kingdom is that we don't always have all these resources, but we still provide adequate medical care, okay? We provide medical, and I would say excellent medical care. That is because we use our knowledge. We've been trained in such a way that you should not always rely on machines to actually give good care. All right. So those of us from the developing world, if we intend to adopt some of their methods of assessing and treating patients, are we in the position to be using those facilities they have that we do not have? Are we in the position to do that? In most of the cases, it's no. So let's take, for instance, before the calculator came into being for you to work your maths, simple maths, we were using our brains. We were using the times table. We were using were thought were methods, like formulas for solving maths questions. Now, we have the calculators. We use them because we have been allowed to use these devices to help us solve situations. Okay, take it, for instance, if these things are no longer available to you, or someone who is somewhere in the village and is solving the same questions like the one in the city, who has no access to these gadgets, what happens to them? Does that mean that they shouldn't be able to solve these questions? I'm all for technology advancement. I'm all for using these gadgets. Honestly, if I know how to use them, I'm so happy using them. I can be that happy using them because it makes the work so easier. But what if they are not available? Does it mean it means you can't do what you're supposed to be doing? Anyway, that's just by the way. Now, I'm going to talk about the pregnant woman who lost her life and her baby at one of the hospitals in Accra. According to reportage, this woman was transferred from another hospital because situation took a turn for the worse. She had complications during labor. So the hospital where she initially checked herself into thought it wise for her to be transferred to a better hospital for a possible CS. And this lady was in the second hospital for 36 hours and died. Okay, sadly, she passed away because they did not have a recovery bed if she had the cesarean section. It's a shame. It's a shame. Honestly, the healthcare workers on duty the other day, it's a shame. It's a shame. I'm not saying it's a shame because you did not do your work properly. Doing your work properly doesn't always mean that you being there and physically sorting a problem out. Communication. Did anyone try to liaise with any other hospital to find out if they had recovery bed and this woman could be safely transferred to them for her to have her cesarean section and deliver her baby safely? Someone will say that it all boils down to money. The family didn't have money, and that caused the delay. So are you telling me that this woman was in the delivery room or on the ward and you were assessing this woman presumably hourly, and nobody spotted that this woman or noted that this woman was getting worse and nothing was done and she passed away? Come on. You know, sometimes some of the stories we tell, some of the things we do, you go home and I'm sure you do, you will go home and you'll be wondering, did I really do the right thing? This is what we call reflection after your day. Did I really do the right thing? This woman, I say, could have been transferred. Okay, the family didn't have money. Is the hospital trying to say that they do not have any emergency funds to be loaned to the family so that they can pay later? I know it may become difficult for you to actually get your money back, but we are talking about lives here, 2 lives. A primate, a newly pregnant woman, somebody's wife, somebody's daughter. So we could not do anything. Those of us who were on duty that day, we couldn't do anything, and this woman sadly passed. How were you assessing this lady? No, did they actually think the labor was going to progress? Were they having adequate, were they seeing adequate contractions and decided to keep this woman till the worst happened? Oh my goodness, this shouldn't be happening. It shouldn't be happening. No, it shouldn't be happening. I'm aware the country is trying so hard. Facilities are being built. Yes, there could be improvement. There could be more. More could be done since me leaving the country till now. I know that more could be done. And honestly, I'm quite impressed at how things are going. But things could be better. Things could be better. We shouldn't build facilities. We shouldn't have buildings to show off and not the buildings work, and not use the building for the purpose that it's supposed to be used for. White elephants? No. So if money has been pumped into setting up such facility, we have to ensure that they actually deliver what they are supposed to be doing. The health workers on duty, were they really trained to handle such situations? Let's put our acts together. Let's put our acts together. Come on, let's do something about this. If there is the need for any updates training, honestly, this hospital should start doing that with their health workers, with their nurses, with their doctors. Let's update our knowledge. Let's update our skills. Don't go have your education and end it there. There is always a room for improvement. The next one I'm going to talk about is the RTA that happened, that the road traffic accident leading to the death of a gentleman. I think Mr. Emisa here, the name is. And I know there's been a probing consultation has taken place as to how and how it happened. Are we doing this because the person is of high profile? I don't know this man from it. I don't know anything. Just something I stumbled on. I think I heard about it first on the news and then on YouTube. When Professor Akosa was talking about, was giving his briefing. Are we saying that it has to take somebody with a high profile? I hope that's not the case, or related to any government official or somewhere in position before debriefing and probing are done. I hope that's not the case. Now, how adequately trained are the ambulance crew? Do we have ambulance technicians who are trauma management trained? If they get onto a site of or scene of a trauma or an accident, do they know what they should be doing? Do they know what they should be doing? It's nice to have those things and then talk about it. Say, me ambulance crew, I'm this, I'm doing that. But do you have the knowledge and skill to actually perform what is expected of you? And those doing the recruitment, do they really recruit people who are able to do the job? Okay, if you do not, you can recruit something who isn't got the skill or knowledge, but do you have plans of training such people? Are there facilities to train these people? Do we provide updates? Because you do not send someone to an accident scene and they get there wanting. Yeah, fine, and then you don't do that. In such situation, you don't do. There is always the ABCD that should be carried. That you need to do assessment. This is like you getting there and not being able to assess the situation, because you need to be able to assess the situation, assess your patient before you can proceed with treatment. So if you do not do this, how do you know how to treat your patient? And the tech crews or ambulance crew are not supposed to be just those who are trauma trained. You should have a trauma doctor, a doctor trained in trauma, or even a senior nurse in trauma. who is able to actually lead if something like that happens. Because you're thinking about controlling, you are thinking about stopping bleeding, you are thinking about immobilizing the patient, especially if the spine is likely to be affected. You are thinking of immobilizing fracture if there is fracture. Someone will be thinking, oh yeah, you have left the country, you've gone and then you've gone to train and you think you can say the and blab. Let me tell you, sometimes it takes you as an individual to be proactive. Has it occurred to anyone to actually speak with their manager or their leader to say that, look, we need these things to be in place for us to be able to perform effectively? Or do we just take our bag, go to work, and then come back home because at the end of the month, we'll take our salaries? I'm not trying to sound insulting. I'm being frank. We are trained. You go through the formal education, you've had your training, but you still need to update your knowledge and skills because they keep happening all the time. Honestly, me being home for this time, I'm kind of thinking, when I should get back to the shop floor, will I be able to perform effectively enough? Because probably things may have happened and things may have moved on. So it's up to me to try and catch up. There are information on the internet. I'm not saying everything you see on the internet is legit. I'm not saying everything you see on the internet is genuine for health professionals. But you research and you research, you find out. This is what the Kente of Experts Club International is about. We learn and we play. The aim is to actually share knowledge, discuss issues, things like this, update our knowledge, because you may be very good at treating some tropical disease and I wouldn't know. So this is my opportunity to learn that from you. Saying all these, that health professionals, we should be proactive and push for things to be done, or try and do that. The government, to some extent, should also be held accountable. We are happy with providing technology, gadgets, the AI stuff, bed managing devices. Before bed managing devices or things like this came, bed managers, I'm talking from with regards to the United Kingdom, bed managers were doing this manually using paper, and effective care was being rendered. Let's start from the fundamentals. Let's make sure our nurses, our doctors, our healthcare professionals, our FLEPs are trained. They are able to render the services that they are supposed to be doing. Then we think about text. We introduce them slowly. The basic knowledge is always the foundation on which you build upon. You cannot say you don't have the basic knowledge and start using gadgets. That's where mistakes happen, because you are using the gadget. The gadget is telling you that the patient is fine and the patient clearly has got pallor. The patient is actually in shock, but the gadget is telling you the patient is fine. So this is where your knowledge, your skill that you have acquired manually comes in. So let's update our knowledge. Let's update our skills. Let's not just rest because we have qualified, and that's what it is. Thank you so much for listening to me. As I always say, be a positive influence or impact wherever you are, because you and your community are responsible for your well-being and the well-being of the people around you. Till I come your way again, I say, this is Janet. Always, always keep healthy. Bye-bye.